Hi, Wesley. Thank you for coming to BizTalk. That's my great pleasure having you with me today. Let's start with yourself, a little bit about who you are and your background.
Yeah, thanks, Max, and thanks very much for having me today as well. So I am the co-founder and CEO of On The Mend. So we are a health tech to transform physical rehab for everyone. And really, my experience with my own knee surgery right back a few years ago is what really triggered me getting into this business. I actually worked in finance for 15 years before starting the company. Mainly in strategy research across investment banks, as also an economist, and previously as a journalist, living around different cities. London, I've lived in Tokyo, and also New York. So had quite a varied career before going into this area. And really, it was a trigger point for me in my own personal life. As I say, going through a surgery, at the point nearly hitting 40 years old, it was quite a change, personally and professionally for me to figure out, where was I in terms of my career, in terms of what challenges I wanted to take on in my life. And I think going through a personal injury, I think, Max, you've mentioned about your own experiences with surgeries and treatments. It's a very, very long and very daunting, very emotionally challenging, obviously physically very challenging experience. And so it doesn't really go away. And I think it was something that sparked a passion in me to try to make it a better experience for people that really have to live with a problem that doesn't necessarily go away. Although it may feel like it does, sometimes in life they tend to come back again because of the way we live and what we do, sitting at desks, maybe not as healthy as we could be, etc. So there are lots of reasons why the idea of improving the experience and also the outcomes of physical rehab is quite a big challenge and a mission that I feel very passionate about, and have managed to really involve myself in the problem and the solution that we're trying to bring to the market for quite some time now. So really have learned a lot, certainly, about this in the last few years.
That's great. Thank you. I mean, I really know what means rehabilitation. It can be very painful, can be very long, and actually you don't even know the outcome. Sometimes it's good, but sometimes it can be, you never reach where you were before. It's a tricky and can be a very tough experience as well. So I'm very happy, especially for someone like me who have been so many injuries, having someone who's taking care of this. Let's talk a bit about On Demand. What is behind On Demand? And yeah, let's give an overview on the business.
Yeah, well, what is behind On The Mend is really certainly a founding team with a real passion, but also a lot of experience in the areas that really matter. So obviously, myself as the patient really champion here, trying to represent all the different emotional, physical, even financial challenges and others that really go with physical rehab and what's associated with it. That certainly is core to the business and really central when we talk about patient-centered care and focusing around the needs of individuals. That really is at the basis of what we are as a business. But also co-founding this business with a surgeon, an orthopedic surgeon, who's come from his own career in technology, in fact, in IT, before he was an orthopedic surgeon. So it's a very rare combination to have that expertise and understanding of the area that we're trying to tackle. Certainly, technology has become more commonplace today, but he certainly thought about a lot of these areas, issues over the last 2 decades. And also a physiotherapist, who I have to say has treated me for my own shoulder injury and surgery, which I had a couple of years ago, before the knee surgery a year before that. So I've certainly gone through these personal experiences, but brought people along the way who've gone through that journey with me, both from the professional side and also developing the product and the business we have today. So we've worked together as a team to really, I guess, understand the problems that exist in the market today. So we're not looking to build, and we never look to build a solution and then find a problem. We were really keenly aware of the core challenges, the real problems that patients have, and how that relates to the healthcare professionals. Those professionals are really trying to understand the needs of their patients and tailor that care around those patients. And it's a buzzword in itself, to tailor care, to personalize, but to understand really what is going through that patient every single day is really what we are all about. And partly that's about motivating the patient to keep doing exercise. So we've designed lots of techniques, and we'll continue to develop lots of techniques around what makes somebody want to get up in the morning, do the most mundane thing, which is the same exercise they were told, or same sets of exercises they were told to do over and over again, whilst to develop that relationship with the healthcare professionals. So allow the healthcare professionals to see critically what that patient is doing. So we give the data around the patient's profile and activity and engagement with the exercises. We give that information to the clinicians who can remotely monitor this. And that makes for a better and more informed consultation. So we know that healthcare professional time is very precious now, especially given all of the COVID backlogs and all the complications. But we're trying to make that relationship work as best as it can for the healthcare professional and the patients, and even for the healthcare professionals amongst themselves, because collaboration is actually a very important aspect of this. Often patients get lost in the system. They go from one part to another. We connect all of these pieces together. So we've created a framework and a platform that connects all the key players in the story. That has the first level benefit of making the patient feel like they are at the center, feeling like the healthcare professionals are using their time most effectively. But also what we're really trying to do is make sure that the payer, the one who is paying for all this treatment, the insurance company, the NHS, regional bodies, these are all aware of what's happening at each stage of the journey, so they can understand how to optimize this care pathway, because there are no clear answers often for what patients should do in certain stages of their life, or when they are at certain stages of an ongoing problem. So we're trying to understand and help a better understanding of how to best treat the patient at what point in time, and how to treat them and with who, etc. And so the answer to that is data, and we've created a framework and a platform that generates the data that will inform all of those decisions.
I mean, you're providing data to the decision makers, who are the physiotherapists, or anyway, doctors, and also to the people who needs rehabilitation, right?
Correct. So there is feedback to the patients on how they're getting on. They can track their progress. They can see where they're improving or not improving. They can also share that with the healthcare professionals, who themselves can make more informed decisions. That's the basis on which we're working, so they can understand when the patient has a problem. Are they actually engaging in their exercises? Why? What's the reason? And we can start to help them analyze, obviously very quickly and efficiently. We've designed a platform that gives them a kind of a one-stop shop to see the patient's progress. But like I said, the interesting words you use about decision makers, there are decisions being made at each stage. The patient decides, today, am I going to keep going? The healthcare professional decides, do I need to see that patient? That's an important decision. And again, the insurance or the payer needs to decide, is it right to continue treating this patient? Should we ask them to go and do everything now by themselves, or should we have them still to engage with the healthcare professional, and should we pay for that treatment? And so we're trying to encourage the best choices to be made by all of the parts of the system. And as I say, that's the way you use data to drive those decisions to the best outcome.
So from my understanding, you had three parts, let's say. You had the patient, you have after the healthcare, and you have the insurance.
Correct, yes.
And they work all together, sharing data on your platform.
Yes, that's correct. So anybody can have access if they've been onboarded by us or by the healthcare professionals onboarding their patients or their colleagues. And we've designed the platform with ISO 27001 compliance. So information security is central and core to the design of the platform. So we've been very careful to ensure that consent and the correct sharing and appropriate sharing of data amongst all the different parts of the system is consistent with those standards.
How does the system works in terms of for the patients to get on your platform, and how they are connected?
Yeah, so the trigger for onboarding to On The Mend is when you have an issue that you need to see a healthcare professional to discuss. So you want to have the healthcare professional really prescribing the system to the patient, so the patient has a sense of trust in terms of credibility of wanting to adopt something. So adoption challenges are often because patients don't see the reason for using something. They're much more likely to adopt something if it's been recommended by their healthcare professional. But again, these are all adoption challenges at multiple levels. So clearly, even then, there's no guarantee patients will sign up. So we try to reduce the risk by having the healthcare professionals as really the gatekeepers to signing up new patients. But also we want the payers to encourage the healthcare professionals and all the providers involved to want to adopt On the Mend. So we want there to be a reason, a positive motivation for the healthcare providers to use this. And the real intention here is to save time, to improve the quality of care, to improve the outcomes, and essentially to deliver a more consistent improvement in the quality of care. And I think that really should be in the interest of all the providers. And by connecting them together, by ensuring there's no, if you like, slippage or leakage out of the system, there's information sharing amongst all the relevant players, then onboarding and adoption should be easier to achieve at scale, which is ultimately the goal.
You're using healthcare professionals to, I don't want to say to get on board clients, but anyway, as the gateway to clients. But what about insurance?
Yeah, so the insurance and the payers in general are going to be, very keen to see a system whereby the data is shared in a seamless way, and the multidisciplinary aspects of the platform will be most attractive to them. So they are going to want to encourage a platform that is going to connect different parts of the supply chain of care at different stages. And again, the way that they operate is that they are trying to achieve the best outcome at an overall system-wide level. And that really does require adoption to be led at the ground level. So you want the healthcare providers to want to use the platform. So again, we need to design a system that saves them time, improves the quality, better engagement, et cetera, et cetera. And by doing so, the payers themselves will be much more inclined to rolling out a system that can be adopted at scale. And I think that is really the objective for us, to have as widespread an adoption across the system so that the payers themselves are not feeling like they're disturbing. They can certainly feel in a positive way they're disrupting the way that care is delivered, but they're not disturbing the balance in terms of how resources are being used, what systems healthcare professionals have to use on a daily basis. So we don't want to take any time. We want to add time to the resources available to healthcare professionals. And ultimately that will make the payers, the insurance companies, much more inclined to onboard and to scale across all their customers this platform as they engage with them in terms of a claim or any other issues along the way in their lives.
Clear. I mean, in terms of business model, how does it work?
Yeah, so our business model as a B2B2C platform. So we deliver this to the system at scale without any cost to the end users. So patients, as I say, will be onboarded to a mobile application which is provided for free to them by the healthcare professionals, who will also have access to a web portal. That system is then being used, as I say, across the different parts of the system. And we are being reimbursed, we're being paid by the providers initially, as we certainly are piloting with those in the coming 12 months. We will look to convert our pilot partners to paying customers. That's the ultimate goal for us in the near term. And so once we have that proof of concept, and we've actually confirmed the pricing model that works best for all the different parts of the chain, we then ultimately look for as I mentioned, the payers to be really adopting this at scale across their platforms, and then that is the same per user reimbursement, but obviously at a much wider, on a much larger scale.
So for my understanding, healthcare providers should pay for using the platform, okay? So they will share, they will pay for the platform. But, for example, you're based in UK, and there is any chance you can work, for example, in NHS or private healthcare providers?
Yeah, so we've designed the platform for adoption across all organizations of healthcare. So there should be no limit to where we can be adopted and used. In terms of the way it integrates into different care pathways, we've been very careful to design, as I mentioned, to not really disturb the workflow and not require any redesign of the pathway of care. It actually complements, in many ways, it mirrors the care that's being provided, but in a way that allows seamless, as I said, data sharing, and obviously things like reduced or elimination of paper ultimately is our goal as well. We want to have a fully digitized care delivery model. So we are creating that interface through our platform, and so this is really the next phase of the business is that level of adoption.
Right. I think we have been already covering a lot. In terms of let's talk a bit more. A little bit more. Let's talk about if you are now fundraising, how much you are fundraising, what's the stage of your startup now? Yeah,
so we are fundraising at the moment to support pilots and product improvement. So that really is our goal, as I mentioned, about the following 12 months. We want to run pilots to achieve our early revenues, a strong product market fit, and really prepare the business for scale, because we've built a platform that's ready for scale. We now need to build a business that's ready for scale. So we're trying to achieve that strong PMF. And I think the UK really offers us at the moment pilot partners that are best suited for what we've designed. So we have built a platform to address particular care pathways initially that we can complement. So hip, knee replacement surgery, where we can support day case, quick discharge from hospital. So we don't want people staying in the hospital beds. We want to encourage them up and on their feet and independent out in the outside world, outside the clinic. That should help us to demonstrate better outcomes, lower cost, improved connectivity and collaboration amongst the system. So that really is our objective. And we are building on a fundraise we did last year. We raised some money to help us to build a platform to achieve the regulatory compliance. As I mentioned earlier, we've managed to prepare the business and the platform for adoption across all healthcare systems, certainly in the UK, and we will look to internationalize as we go beyond our early pilots. But this is now for us to work with the partners that we've develop relationships, certainly through our team. We have clinicians, as I mentioned, in our team, and that's something that's helped us to find early adopters. And we will use the organizations where they are based to help us to demonstrate impact and to start to really pitch this to customers beyond just pilots and demonstrating value.
You have been talking about regulators. Now, you mentioned before that's a very flexible, let's say, platform, adapting to any, adoptions. But when it comes to approval, do you need approval from regulators?
So in terms of regulations, certainly for hospital studies that we're trying to run, I would say ISO 27001 is certainly a very strong requirement, as is Cyber Essentials, which we've also achieved, and the NHS Data Security Protection Toolkit. So these types of frameworks are designed specifically to avoid any issues that you can encounter when it comes regarding data sharing or any type of requests or use of data that patients are providing. Clearly, the security of that data is the utmost importance. So we've built the platform with security in mind from day one. And that really is the requirement that you need to adhere to if you're going to operate in a healthcare system, certainly within hospitals and also as well within the community, so that any data that's shared at any stage of the journey is secure and will be accessible to the people that need it, and for the reason that we've described in our policies.
Well, in terms of scaling, for scaling, how are you going to scale your business in terms of revenue streams, and how are you going to scale your business in terms of services?
Yeah, that's a really, really good question, because it comes to the heart of really what is the return on investment for investors that enter the business at this very, very early stage, which we appreciate, is considered to be the riskiest stage. But I would suggest that because we've built, as I said, a platform with a very, very core and strong understanding of the problems that are faced on the ground. So these are not decisions by committee and in design on a computer and then testing to see, whether the real world will adopt. these are designs and ideas, even early stage concepts. We're still at the MVP stage, that are very, very grounded in the reality on the ground. And so certainly the COVID experience in the last year has only really grown the pipeline for us of business, because there is a massive backlog of elective surgery. Orthopedics are at the highest end of the biggest category of elective surgery waiting lists on the NHS today in the UK. But this is a vast problem. In the US, 1 in 2 people are affected by problems affecting muscles, bones, or joints every year. It's a huge, huge market. 200+ billion is spent in the US. In the UK, we see 5 billion in the NHS, but certainly there are large, vast swathes of the market which we can try to tackle. And I would say the main principle would be this, and this is why I think the payers would be just as excited as the providers. So our goal, as I say, is to transform physical rehab for everyone. And what that's really trying to do is to make sure that the outcome of physical rehab is the best that it can be for anyone going through it. And so if somebody is trying to avoid surgery, they should use On the Mend. If they're trying to have the best outcome from surgery, they can use On the Mend. Even if they just feel like they're not as young as they used to be, and they want to improve their general health, but they need to be given some recommendation of how to do it, they can use On the Mend. And in terms of just general disease management, in terms of how the scale of this problem is so widespread and is only going to get worse with aging demographics, there really is a lot of opportunity for us to tackle this. And clearly these issues are not going to go away. They're only going to get only bigger. So we've really tried to hone in on the specific pathways to become experts in a very particular area, as you like, in the initial phase, but then we can become masters of a very vast number of conditions in the future, because there's a common problem associated with it in terms of motivation, in terms of sharing of information, the best use of time that clinicians make when they see their patients, and the outcomes they achieve. So we are focusing on certain pathways. We will widen it to others. So from hips to knees to shoulders to ankles to wrists to every other problem that you can imagine that requires physical rehab. We will go from different parts of the system in different parts of the country and all over the world. This is a platform we've designed to scale. And as I said, to encourage adoption is key. If it's not being used, it's not going to grow. And so our focus is very much on how we get adoption first, and then we get scale second. And that's really what we've designed the business for.
Thank you so much, Wesley. I mean, I have one question that's very, just curiosity for me. When it comes to scaling, we are talking about physical rehab, okay? But we know rehabilitation is after any surgery, any. If you can have the best surgery, but if you don't actually do the right rehabilitation, the surgery will disappear. And the good one can be bad. And I know perfectly well because I've been through this. And one day, can you use your platform for any surgery, rehab, or actually not only physical, but also psychological?
So that's, again, a fascinating question, and one that we obviously think about a lot, because we're trying to build a platform that is not just scalable, but as scalable as it can be. So we're really thinking about the motivation challenge, as I said, the disease management, in terms of the outcomes, in terms of costs. These are very general concepts that apply to a very wide range of issues. And I would say the only constant factor is the aging. I would say the complexities, the comorbidities, as they're called, people having more than one condition at one time, this is the driver. Because when you have one problem with your shoulder, you have a problem with your back. If you have a problem with your knee, it's because you have a problem. These things go around. And I think the problem most people face is not really understanding about their condition, about what's driving it, about how do you treat it. And so, as I said, the field which we can plow with this business is so vast. It is, I think, in a way, the opportunity and the risk, because we want to focus. We have to be focused. We have to take on specific problems that we can demonstrate a very measurable impact. And I think by doing that, validating our value proposition. But at the same time, we should be ready. And I have to give full credit to our chief medical officer, as I said, from a former IT professional but surgeon today. He's really encouraged me from the very beginning. When I came to him as a patient, trying to design a system to encourage motivation with physical rehab, he was always very careful to design a system that would be adopted by the healthcare system first, even though, you know, I still want to make sure the patient is the center of this journey, and we've designed all our products around that story. But in terms of the business and the way that we are designed as a business, it is around helping the system work the best it can for everyone. And I think that is something that certainly as a patient, while, you know, with the best will in the world, I would love to have done that without anyone, you know, supporting me directly in terms of my need to depend on others. It is a true team effort. This business was a true team effort and really required everyone to come together and to build something that would be suitable for the healthcare system, which, as you know, you work in a GP surgery, you don't know who's coming in 1 minute to the next, but we want to be in the seat of the GP and understand their situation as much as the patient on the other side. And so if you start on that basis, you tend to find you build something that can really start to address a very wide range of problems. So that's what we hope to do.
Yeah, absolutely. And you are building trust, which is healthcare needs a lot.
Very good.
Let me close with this. How much are you raising and why investor should invest on your business?
Yeah, well, we are raising £250,000 today, and that will give us a 12-month runway to run our pilots to evidence the impact in the system. We are running a crowdfunding campaign. We have some percentage, nearly half of the round committed by other investors. We're certainly looking to close the round quickly and move forward with the pilots in this second half of this year and into next. And so, yeah, there's a lot of work to be done, and we're very keen to speak to investors who want to work with us and help transform physical rehab for everyone.
Thank you very much, Wesley. It's been a great pleasure with you today. And let me say, we met 2 years ago in my office in London. You had done an absolutely great job. You improved a lot yourself. Very much.
Thank you, Max. I really appreciate that. It has been a tough time for everybody, but I think, you know, it tests you and helps you get stronger. And that's certainly what we've done as a business, is realize the challenges of the real world and how it takes to get through it. So very excited about the future. Indeed.
I hope we can talk soon, maybe next round or whatever.
Look forward to it. Take care then, Max. Thank you very much.